doctor's honest truth. 8 things you need to know. If you're 70 or 80 and still masturbating. As we enter our 70s and 80s, many of us may begin to wonder how aging affects our sexual health and desires. One topic that is often misunderstood and avoided is masturbation. While it remains a natural part of human sexuality, discussions about it in later years are frequently avoided due to stigma and societal perceptions. However, understanding and addressing these natural changes in sexual health is essential for fostering a healthy relationship with our bodies and desires. In today's video, I will share 8 important things every older adult should know about masturbation and sexual health. From the physical changes our bodies undergo to the emotional complexities we may face, understanding these aspects will help us embrace our sexuality in a more fulfilling and confident way. Whether you're navigating these challenges yourself or supporting a loved one, this discussion will provide valuable insights, expert tips, and methods for adapting to these changes while enhancing sexual pleasure. Together, let's embark on this important journey of self-awareness and well-being. 1. Physical changes in the body. As we grow older, our bodies undergo significant physiological changes that influence our overall health and sexual well-being. Aging is a gradual process that affects various bodily systems, and many of these changes have an impact on sexual function and pleasure. Hormonal changes. One of the most significant physical changes related to aging is the decline in hormone production. In men, testosterone levels begin to decrease around the age of 30 or 40 and continue to decline gradually throughout life. This decrease in testosterone can lead to a reduction in libido and difficulty achieving or maintaining an erection, a condition known as erectile dysfunction, ED. These changes can affect the frequency and intensity of sexual pleasure, leading to feelings of frustration or diminished self-esteem. In women, the onset of menopause, typically occurring between the ages of 45 and 55, causes a dramatic drop in estrogen and progesterone levels. Estrogen is vital for maintaining vaginal health and sexual function. As estrogen decreases, vaginal walls can thin, elasticity can reduce, and natural lubrication can diminish, leading to vaginal dryness. This can cause discomfort or pain during sexual activity, including masturbation. Additionally, some women report a decrease in clitoral sensitivity, which can reduce sexual satisfaction. Reduced circulation and muscle tone. As we age, circulation throughout the body can become less efficient, including in the genital area. Healthy blood flow is essential for sexual arousal, and a reduction in circulation may make it more difficult to achieve arousal or orgasm. Furthermore, aging often leads to a decrease in muscle tone, including the pelvic floor muscles that play a key role in sexual function. Weakened pelvic muscles may lead to reduced control over sexual responses and lessened sensation. Psychological impact. These physical changes can also take a psychological toll. Many people experience anxiety, embarrassment, or feelings of inadequacy as they notice changes in their sexual function. This can worsen sexual difficulties and impact overall well-being. Recognizing these changes as a normal part of aging is the first step in addressing them effectively. Fortunately, there are numerous ways to manage and overcome these physical changes. Medical treatments, such as hormone replacement therapy, pelvic floor exercises, and various medications, can help maintain sexual health and improve function. Understanding the natural changes our bodies undergo can help us navigate these challenges with greater confidence and fulfillment. 2. Potential health risks. While masturbation is generally considered a safe and natural activity that provides both physical and psychological benefits, older adults should be aware of potential health risks associated with age-related changes and pre-existing medical conditions. As our bodies age, they can become more vulnerable to strain or complications from physical exertion, even during sexual activities like masturbation. Cardiovascular risks. As we get older, our cardiovascular system becomes more fragile, and certain health conditions such as heart disease or high blood pressure can make physical exertion more risky. Sexual arousal and activity, including masturbation, can increase heart rate and elevate blood pressure, which may strain the cardiovascular system, particularly in individuals with existing heart conditions. If you experience symptoms like chest pain, dizziness, or shortness of breath during or after sexual activity, it's important to consult a healthcare provider. They may advise modifying your sexual practices or suggest alternative ways to maintain sexual health without putting undue pressure on your heart. Arthritis and joint pain. Older adults often experience arthritis or joint-related issues that can affect mobility and comfort during physical activities. For some, masturbation may involve repetitive movements or certain positions that could exacerbate joint pain or inflammation. If you have arthritis or other joint conditions, it's important to be mindful of how these positions or actions affect your comfort and flexibility. Using supportive cushions, experimenting with gentler techniques, or adjusting your posture may help minimize discomfort and reduce the risk of joint strain. Medication interference. Many older adults take medications to manage chronic health conditions such as diabetes, hypertension, or depression. However, some medications can interfere with sexual function. For example, medications for high blood pressure or antidepressants may cause a decrease in libido, difficulty achieving or maintaining arousal, or delayed orgasm. It's essential to be aware of the potential side effects of your medications and to communicate with your healthcare provider about any concerns. Your doctor may adjust your medication or suggest alternative treatments to improve sexual function. Nerve sensitivity. Certain health conditions, particularly diabetes, can affect nerve function and reduce sensitivity. This can make sexual pleasure less intense or more difficult to achieve. Maintaining regular medical checkups and discussing any changes in sexual function with your healthcare provider can help identify the underlying cause and offer possible solutions. Being proactive about health. As we age, it's important to approach sexual health with mindfulness and patience. Recognizing that modifications may be necessary to ensure safety and satisfaction is key. By being proactive about your health and staying informed about potential risks, you can continue to enjoy masturbation and other sexual activities as a positive and safe aspect of your life. Remember, consulting with your healthcare provider can help you navigate these risks and find ways to maintain sexual satisfaction while considering your overall health needs. 3. Mental and emotional health. Sexual expression, including self-pleasure such as masturbation, offers significant benefits for mental and emotional well-being. Engaging in sexual activities triggers the release of feel-good hormones like endorphins and oxytocin, which can alleviate stress, improve mood, and promote overall relaxation. For older adults who may experience unique stressors related to aging, such as health concerns, loneliness, or a loss of purpose. This natural release of tension can be especially therapeutic, contributing to a greater sense of personal happiness and emotional balance. Positive impact on mental health. Masturbation can be a healthy way to reduce stress and improve emotional well-being, especially when facing the challenges that come with aging. The physical release that accompanies sexual activity provides a sense of relaxation and can improve overall mood. This is particularly important as many older adults may face feelings of loneliness or sadness. Masturbation offers a temporary but effective way to self-soothe and relieve built-up tension, contributing to emotional resilience and a better quality of life. Feelings of guilt or shame. Despite these benefits, many older adults may still struggle with feelings of guilt, shame, or discomfort when it comes to sexual activities, including masturbation. These negative emotions often stem from societal stigmas or outdated cultural beliefs that view sexuality in older populations as inappropriate or irrelevant. Many individuals may have internalized messages throughout their lives that associate sexual pleasure with immorality or weakness, leading to deep-seated feelings of embarrassment or even self-judgment. These emotional barriers can cause distress and negatively impact mental health. When left unaddressed, feelings of shame and guilt surrounding sexuality can contribute to isolation, low self-esteem, and anxiety, further diminishing quality of life. It's crucial to recognize that these emotions are often rooted in societal misconceptions, rather than any inherent flaw or issue. Overcoming emotional barriers. It's important to foster open, supportive conversations about sexual health and aging to help dispel myths and reduce stigma. By creating environments where older adults feel safe and respected, we can normalize the concept of sexual expression at any age. Healthcare professionals and community leaders play a vital role in providing compassionate guidance, promoting education, and offering support. Talking openly about sexual well-being helps older adults embrace their sexual identity without fear or shame, ultimately enhancing their mental and emotional health. Encouraging dialogue can lead to a healthier relationship with oneself and can promote self-acceptance, which is essential for overall mental wellness. Empowering older adults. By acknowledging the importance of sexual health and emotional well-being, older adults can experience a greater sense of self-worth and connection to others. This can lead to improved mental health, more fulfilling relationships, and greater happiness. Masturbation, in this context, is not only a physical act, but also a means of self-care that nurtures emotional and psychological well-being, enabling individuals to enjoy a more balanced and empowered life. Ultimately, overcoming emotional barriers related to aging and sexuality helps to create a more inclusive, supportive environment where older adults can embrace their desires and live their lives with dignity and joy. 4. Social isolation and loneliness. Social isolation and loneliness are increasingly common among older adults and have a significant impact not only on mental and emotional well-being, but also on various aspects of physical health, including sexual health and behaviors. As people age, life transitions such as retirement, the loss of loved ones, or decreased mobility can lead to feelings of isolation and a withdrawal from social circles, often leaving them feeling disconnected from their community and support networks. Impact of loneliness on sexual health. The profound sense of loneliness that often accompanies these transitions may drive older adults to focus more heavily on solitary activities, including masturbation, as a way to cope. For many, engaging in solitary sexual activities can provide a temporary sense of comfort, pleasure, and stress relief. Masturbation, in this context, can serve as a natural response to isolation, fulfilling basic human needs for intimacy and physical release, even in the absence of close relationships. However, while self-pleasure can be a beneficial coping mechanism, it's important to understand that relying too heavily on solitary activities can sometimes exacerbate feelings of isolation. Focusing solely on self-soothing behaviors may prevent individuals from seeking meaningful social interactions or connecting with others emotionally, which could contribute to a deeper sense of loneliness. The cycle of isolation and emotional health. Prolonged periods of loneliness and isolation can also negatively affect mental health, contributing to conditions like depression, anxiety, or a general lack of motivation. These emotional challenges can create a vicious cycle where the individual feels more withdrawn and disconnected from others, which in turn can deepen feelings of loneliness. This cycle can lead to further social withdrawal and a decline in both emotional and sexual well-being. Maintaining a balanced lifestyle. To combat these challenges, it's crucial to seek opportunities for social engagement and connection. Even though it may feel difficult at first, taking small steps to reconnect with others can make a significant difference. Simple actions like joining community groups, participating in fitness classes designed for older adults, volunteering, or reaching out to family and friends can help reduce feelings of loneliness and provide emotional support. Maintaining a balance between self-pleasure and social interaction is key to promoting overall well-being. While masturbation can be a healthy outlet for physical and emotional release, it's equally important to nurture relationships and engage in activities that foster genuine connection with others. Building and maintaining a supportive social network not only improves emotional health, but also enhances sexual well-being by boosting self-worth and providing a sense of belonging. Role of healthcare providers and communities. Healthcare providers and community organizations play an essential role in helping older adults combat isolation and loneliness. By creating spaces for older individuals to meet and engage with others, they can help reduce feelings of social disconnection. Initiatives like social events, group counseling, or wellness programs specifically designed for older adults can offer opportunities to build meaningful relationships and foster a greater sense of community. Communities and healthcare professionals can also support older adults by encouraging a holistic approach to health, one that integrates physical, emotional, and sexual well-being. When these aspects of health are interconnected and supported, individuals can experience a more fulfilling and balanced life, reducing the negative effects of isolation and improving their overall quality of life. In conclusion, while masturbation can offer temporary relief from loneliness, it's crucial for older adults to seek a balance between self-pleasure and genuine social connections. Engaging in both social and solitary activities helps prevent feelings of isolation and fosters a more enriching and connected life, promoting both emotional and sexual health. 5. Sexual health and communication. As people age, maintaining sexual health remains an integral part of overall well-being and quality of life. For older adults who are still sexually active, open and honest communication with partners about desires, preferences, and any changing needs becomes even more crucial. Aging often brings about physical and emotional changes that can affect sexual experiences, such as reduced libido, changes in vaginal lubrication, or difficulties in achieving or maintaining an erection. These shifts are completely normal and part of the aging process, but they can create challenges if left unaddressed in relationships. The importance of open conversations. One of the key factors in maintaining a fulfilling sexual life as we age is communicating openly with our partner about changes in sexual function. For instance, some older adults may find that physical intimacy is more rewarding when it involves touching, kissing, or cuddling rather than intercourse itself. Others may continue to enjoy a full range of sexual activities. Discussing these evolving preferences can enhance both physical pleasure and emotional connection in a relationship. Talking about masturbation can also be an important part of this conversation. Sharing thoughts about personal sexual experiences or habits can help partners understand each other's needs, relieve sexual tension, and discover new ways to find pleasure, either individually or together. This kind of communication can reduce misunderstandings, dispel insecurities, and help foster a deeper emotional connection between partners. Addressing physical and emotional changes. As the body ages, various health conditions, such as arthritis, diabetes, or cardiovascular issues, may alter one's sexual capacity, stamina, or comfort during sexual activity. For example, individuals with arthritis may experience joint pain, which can make certain positions or movements uncomfortable. Similarly, those with diabetes may experience changes in nerve sensitivity, which can affect sexual pleasure. It's important to address these changes openly with a partner. If physical discomfort or emotional concerns arise, discussing them can allow both partners to adjust their expectations and explore new ways to experience intimacy. Healthcare providers can also offer advice on potential solutions or therapies that may help. Options such as pelvic floor exercises, hormone replacement therapy, or medications designed to alleviate sexual difficulties can be discussed with a healthcare provider to improve sexual function. Therapeutic support. If emotional barriers or past traumas are affecting sexual well-being, seeking professional help from a therapist specializing in sexual health can be invaluable. Many older adults may feel anxious or insecure about their changing bodies, and a trained professional can offer strategies to overcome these concerns. Therapy can also help individuals and couples address long-standing fears or anxieties about aging bodies, ultimately leading to greater sexual confidence. Building intimacy through communication. By prioritizing sexual health through open, respectful communication, older adults can continue to enjoy a fulfilling sex life that evolves with their changing needs. Whether discussing new preferences, physical challenges, or emotional concerns, having honest conversations allows partners to adapt and find ways to remain connected. This mutual understanding helps build trust and strengthens intimacy, enabling both partners to feel more comfortable, secure, and satisfied in their sexual relationship. In conclusion, communication is key to maintaining sexual health in later years. By addressing physical, emotional, and sexual changes openly with a partner and seeking professional advice when necessary, older adults can continue to experience fulfilling intimacy. Prioritizing open discussions about desires, concerns, and new experiences ensures that sexual health remains a positive and empowering part of aging. 6. Exploring new techniques. As we age, our physical capabilities evolve, and this often calls for adjustments in how we experience and enjoy sexual pleasure. What once worked effortlessly in our youth may now require creativity and a bit of experimentation. However, this can also open up exciting opportunities for exploration, self awareness, and deepening intimacy. Embracing and experimenting with new techniques can be incredibly enriching, especially when it comes to solo sexual pleasure. Adapting to physical changes. One of the most noticeable changes that occur with age is a difference in skin elasticity and natural lubrication levels. For women, hormonal shifts during menopause or postmenopause can lead to vaginal dryness, while men may experience changes in skin sensitivity or erectile function. These changes can make sexual activities feel different, but they don't necessarily diminish sexual enjoyment. Instead, they present an opportunity to try new methods and find what works best for your body at this stage of life. Using high-quality lubricants is one of the simplest and most effective ways to enhance comfort and pleasure. There are several options to choose from, including water-based, silicone-based, and oil-based lubricants, each offering unique sensations. Water-based lubricants are gentle on the skin and easy to clean, while silicone-based options provide longer-lasting glide and are ideal for extended sessions. Trying different types of lubricants can add variety and comfort to the experience. Introducing sex toys for older adults. In addition to lubricants, the introduction of various sex toys designed specifically for older adults can revolutionize the sexual experience. These toys are crafted to accommodate shifting physical needs, with ergonomic designs that are easy to handle and control. For example, vibrators come in a wide range of styles, from gentle external stimulators to more intense devices that create deep sensations. These toys can offer new forms of pleasure, especially for those who experience issues like arthritis or reduced grip strength. Some sex toys are designed for dual stimulation, targeting multiple erogenous zones simultaneously, which can enhance pleasure and satisfaction. Features like remote controls or wearable options ensure that these toys are accessible and easy to use. Experimenting with these new devices can help discover new dimensions of sexual pleasure and satisfaction. Exploring sensory play. Aside from lubricants and toys, exploring sensory play can be another exciting avenue for enhancing sexual experiences. This may involve trying temperature play, such as using warm or cool objects to stimulate the skin, or incorporating textures with different surfaces, such as silk or leather. These sensory experiences can heighten arousal and add new sensations that may not have been part of the experience in earlier years. Creating the right mood is also important. Setting the scene with soft lighting, calming music, or scented candles can enhance relaxation and make the experience more sensual. Slowing down and being present at the moment not only deepens the pleasure, but also fosters a stronger mind-body connection. Mindfulness and connection. As we age, we may find that the pressure to perform lessens, allowing for a deeper connection with our own bodies and desires. Slowing down and paying attention to how certain techniques feel can lead to a more fulfilling experience. Engaging in mindful sexual practices, where the focus is on sensation rather than performance, allows for a more intimate and gratifying encounter with oneself. Exploring new techniques, whether through experimentation with toys, lubricants, or sensory play, can help older adults maintain a satisfying and enjoyable sex life. These new approaches not only adapt to physical changes, but also create opportunities for self-discovery and empowerment. Embracing this phase of life with curiosity and creativity can help keep sexual expression fulfilling and enjoyable. The journey of self-discovery. Ultimately, exploring new techniques is about reconnecting with your desires and learning what feels good to you at this stage of life. By embracing this phase with openness and curiosity, older adults can continue to discover new ways to experience joy and satisfaction, enhancing both their sexual and emotional well-being. 7. Seeking professional advice. Taking the step to consult with a healthcare provider about sexual health, including any concerns or questions related to masturbation, can be both reassuring and enlightening. Medical professionals are well equipped to offer personalized, evidence-based guidance that is tailored to an individual's unique health needs and lifestyle. As we age, it's important to approach sexual health as a vital part of overall wellness, just like physical fitness, mental health, and nutrition. Personalized advice for sexual health. Healthcare providers can address specific medical issues associated with sexual activity, such as pain, discomfort, or psychological concerns. For example, if an individual experiences difficulty achieving orgasm, persistent pain during sexual activity, or any other discomfort, a healthcare provider can assess the situation and offer comprehensive recommendations for safe, healthy sexual practices. This might include lifestyle changes, medications, or specific therapies aimed at improving sexual function. Doctors can also provide guidance on managing chronic conditions, such as diabetes or cardiovascular issues, that may affect sexual health. By discussing how these conditions influence sexual function, healthcare providers can help patients make adjustments to their sexual practices and recommend treatments, such as pelvic floor exercises, hormone replacement therapy, or medications to help maintain a fulfilling sex life. Addressing misconceptions. An important part of seeking professional advice is dispelling myths and misconceptions related to aging and sexuality. Many people may believe that sexual activity, including masturbation, becomes less important or should be avoided as they age. Healthcare professionals can offer clarity on what is considered normal and healthy, reinforcing the idea that sexual health is an ongoing part of life, regardless of age. By having open and honest discussions with healthcare providers, older adults can gain confidence in understanding their sexual health and dispel any uncertainties they may have about what is normal for their age. A healthcare provider can also help address any mental or emotional barriers that may affect sexual well-being, such as shame or anxiety, and suggest resources like therapy or support groups to assist with emotional and psychological concerns. When to seek professional help. If sexual health concerns persist or begin to significantly impact one's quality of life, it's crucial to seek professional guidance. This is particularly important if sexual difficulties are accompanied by emotional distress, relationship issues, or a decline in overall well-being. A healthcare provider can evaluate the situation and recommend treatments or referrals to specialists, such as sex therapists or counselors, who can further assist in addressing complex issues related to sexual health. Additionally, if someone feels that their sexual health is affecting their emotional stability or relationships, working with a therapist who specializes in sexual health can be highly beneficial. A trained professional can provide strategies to overcome barriers such as fear, anxiety, or insecurity about the aging body, helping individuals to regain confidence and foster healthier relationships. Creating a safe and supportive environment. Consulting with a healthcare provider also helps to create a safe and confidential space for discussing sexual health. Healthcare settings are designed to support patients without judgment, allowing individuals to discuss sensitive topics openly. This approach helps to normalize conversations about sexual health, reinforcing the message that these concerns are just as important as any other aspect of health. Informed decisions for sexual well-being. Ultimately, seeking professional advice is about empowering individuals to make informed decisions about their sexual health. With the right guidance and support, older adults can continue to experience a satisfying and healthy sex life, knowing they have the tools and knowledge to navigate the challenges that come with aging. By addressing concerns proactively, individuals can lead a more fulfilling, confident, and empowered life in their later years. In conclusion, reaching out to healthcare providers for advice on sexual health is an essential part of maintaining overall well-being as we age. It allows individuals to stay informed, address concerns, and receive personalized recommendations that help maintain a satisfying and safe sexual life. 8. Embracing your sexuality. As we journey through life, it's essential to understand that sexuality is a vital and enduring part of our identity, regardless of age. For many individuals in their 70s, 80s, and beyond, the desire for sexual pleasure remains strong and continues to contribute significantly to overall well-being and happiness. Acknowledging and embracing this aspect of yourself can lead to a richer and more fulfilling experience, rooted in self-acceptance, confidence, and joy. Reconnecting with your body and desires. As we age, we often find greater freedom to explore and redefine our sexual expression. Unlike the performance-driven expectations that often characterize younger adulthood, older age allows for a focus on the quality of the experience. Sexuality in later years can become more about enjoying the sensations and emotional connection rather than meeting societal standards or fulfilling physical performance. This shift allows for a more profound, satisfying sexual life. For some, embracing their sexuality later in life may involve exploring new forms of intimacy, such as experimenting with different types of physical connection or deepening emotional bonds with a partner. For others, it may mean rediscovering the joy of masturbation and self-pleasure. No matter the form, prioritizing sexual health and well-being can bring a renewed sense of vitality and connection to one's body. Managing physical changes. It's also essential to approach sexual health holistically, as our bodies undergo natural transitions with age. For women, hormonal shifts may lead to vaginal dryness or decreased sensitivity, while men may face challenges with erectile function. These changes are common and manageable. With the help of lubricants, hormone therapy, or pelvic floor exercises, these physical shifts can be addressed in a way that ensures comfort and enjoyment. Sexuality in later life can also involve exploring new avenues of intimacy, whether through solo activities like masturbation or through a partner. Open communication with a partner about changing needs and desires helps foster trust and respect, making it easier to adapt to these changes together. Some older adults also find that their emotional connection with their partner becomes a more significant part of their sexual experience, enhancing intimacy and pleasure. Self-pleasure without shame. Self-pleasure or masturbation continues to be a healthy and natural part of sexuality throughout life. It can serve as a source of stress relief, improve sleep, boost self-esteem, and help maintain sexual function. Embracing self-pleasure without shame or guilt is essential for fostering a positive relationship with your body. By exploring what feels good and discovering new ways to experience pleasure, older adults can enhance both their sexual and emotional well-being. Many people find that as they age, they become more attuned to their bodies, and this self-awareness leads to a greater sense of confidence. Taking time to learn what feels pleasurable and enjoyable can be empowering, helping individuals embrace their sexuality fully without fear or embarrassment. Emotional and psychological well-being. Beyond physical pleasure, sexuality in later life also nurtures emotional and psychological well-being. Intimacy often fosters a sense of connection and belonging, reminding us that our need for touch and closeness is both human and profound. For those who are single or navigating new relationships, it's equally important to honor one's desires while also being attentive to emotional readiness and safety. Conclusion. In conclusion, while aging may bring unique challenges to sexual activity, it does not diminish the importance or validity of sexuality in later years. By understanding and embracing the physical, emotional, and psychological aspects of sexual health, older adults can continue to experience fulfilling and meaningful sexual experiences. Whether through self-exploration or intimacy with a partner, prioritizing sexual well-being can lead to a more empowered and enriched life. Remember, sexuality is a vital part of who we are, and it can remain a source of pleasure, connection, and joy at any age. Embrace your sexuality with confidence and curiosity, and enjoy the many ways it can enhance your quality of life. In conclusion, while masturbation and sexual activity in older age may come with unique challenges, they remain a natural and beneficial part of life. As we age, our bodies and minds experience changes, but understanding these transformations and approaching sexual health with openness can help us continue to enjoy fulfilling and meaningful sexual experiences. Whether through exploring new techniques, communicating openly with partners, or embracing self-pleasure, older adults can maintain a healthy, enjoyable relationship with their sexuality. It's important to acknowledge that sexuality does not lose its significance with age. Embracing this aspect of ourselves, with all its complexities, can lead to a richer, more satisfying life. Taking proactive steps to address physical changes, seeking professional advice when necessary, and fostering open conversations about sexual health are all essential to ensuring that sexuality remains a positive and empowering part of aging. Remember, sexual well-being is integral to overall health, and by embracing it with curiosity, confidence, and self-acceptance, older adults can continue to experience joy, intimacy, and connection. Your sexuality is a lifelong part of your identity, and there is immense value in exploring and celebrating it at any age.